Services issued a health alert on increasing cases of rabies being recorded in the Ashanti region. A statement signed by the Ashanti Regional Health Director, Dr. Emmanuel Tinkran, indicates that the said deaths have been recorded from 4 cases detected in 3 different districts of the Ashanti region. They include the Ashanti Achim South, Bosomtwi, and also Kwabe East. We'll hear from an official with the Ghana Veterinary Services shortly. But first, here's the alert released by the Ashanti Regional Health Directorate. So you have SEPS, first of all, indicating that the Regional Health Directorate brings to the notice of all health facilities arising the confirmed outbreak of rabies cases and deaths in 3 districts in the Ashanti region. As of Monday, the 12th of September 2022, the region had recorded a total of 4 confirmed cases and, of course, 1 probable case. The cases were reported from the Ashanti Achim South and also Bosomtwi, as well as the Kwabre East areas. Now, the case fatality was 100%, as we're getting from the officials. Now, the public health actions to be undertaking are, first of all, enhanced community public sensitization on rabies. Then there's the issue of improved case search for rabies in the facilities, and also a follow-up and an issue of treating all cases of dog bites. There's the aspect of liaising with veterinary officers in the districts for dog vaccination activities. So that's the roadmap being rolled out by the authorities. Now, the case definition of human rabies, we do know, has got to do with suspected issues relating to 1 person or more, and there are some symptoms of headache, neck pain, nausea, fever, as well as some more issues. And of course, in terms of the confirmed case that we have, a suspected case, there are some checks going on in the labs to confirm that. So that's been signed by Dr. Emmanuel Tinkran, who's the Regional Director of Health Services in the Ashanti region. So joining me now is Benjamin Kisi Sasu, Risk Communications Officer at the Ghana Veterinary Services Directorate. We also have Dr. Lawrence Lati, of the who's the head of Port Health at the Ghana Health Service, and Dr. William Chiam, a senior lecturer, School of Veterinary Medicine at the Kwame Nkrumah University of Science and Technology. Thank you all for your time. Let me start off with the veterinary service. Obviously, the issue about how the public could protect themselves. Looking at the findings that you have, what's your view, first of all, in dealing with the matter when it comes to public safety? What do we need to know, Benjamin Kisi?
Okay, great. So first of all, I'd like to send my greetings to your viewers. Unfortunately for us, Ghana currently, September is our Rabies Awareness Month. This is due to the fact that all over the world on 28th September is the World Rabies Day. And we have some few days more to 28th, and to Ghana experience this sudden news. It's so sad that we are coming up to this. But this is also a call for action, because countries all over the world, including Ghana, have signed to a charter that 2030 we should be able to eradicate rabies in Ghana. And we have about almost 8 years more. We are 2022, so we hope to have by 2032 we're there. So getting this is so sad for the country, but we still need to get on and quickly work towards. We still have some few years more. And this is a call to all agencies and to government and relevant institutions to let us marshal the necessary efforts and resources so that we could be able to get back to the good path, so that by 2030 we're part of the countries that would have rabies eradicated in our country. It's so sad that we have come to this point, but lucky for us, we have the system in place. So quickly activated, and current investigation is ongoing to see where the source is, and also, as the letter read, to do a lot of awareness and sensitization so as to get everybody well informed of the issues. So far, this is the issue on ground. The only issue is that a lot of Ghanaians don't know much about rabies. A lot of work have been done, and I'm happy that our senior colleague is also here to show more light about it. It's a neglected disease in Ghana. When people hear about rabies, they feel it is not closer, they feel it's far away from us, and they feel it's just with only animals. But we all need to play an essential role. So as the matter has come, we ask the public not to fear. We don't need to panic. The systems are at place. Rabies is 100% fatal, yes, but it's also 100% person preventable. When we say it's 100% fatal, it means once somebody contact a rabid animal, it starts to show signs and symptoms, nothing can be done about it unless there is a divine intervention. The person would, no matter what, would lose his or her life. And that always happened all over the world. There's no any treatment.
Dr.
But the good news
Lati,
is that it's vaccine preventable. That if we are vaccinating our pets, being a responsible owner, would have this problem not with the pets. Research shows that more of the cases we are getting, more than 70% are dog-mediated cases or mediated bites. And we have dogs. That doesn't mean we are saying that people should hate animals, but we are humans who are born for them. We need to shelter and do the necessary vaccination protocol. In that, when we do so, we will not have the animals be affected, which will have the consequences on human life, as we are seeing currently in Ghana and Ashanti Region. We hope everything is maintained in such a way.
Dr. Lati, for the Ghana Health Service, what immediate steps are you taking to check this?
Please, can you repeat?
The question is to Dr. Lati. Yes, Dr. Lati, you'd have to unmute so I can get the point you're making. Dr. Lati, can you hear me? We can get the point you're making. So
okay, I can hear you.
Yes, yes. I was just asking about.
I can hear you.
Yes, I was just asking about the measures.
Yes, thank you very much for having me. So, as a service, as a system of surveillance that was able to pick up these cases of rabies that has been reported in the Ashanti region. And as my colleague Benjamin rightly said, community sensitization is one of the key protocols that we follow, especially when cases are reported. And of course, record shows that 4 out of 10 deaths usually involves children. So during this period, when there are outbreaks, it presupposes that there are rabid dogs within the communities, especially stray dogs. And for that reason, owners of the dogs are being encouraged and advised to vaccinate their dogs and keep them in check. And of course, children, when they close from school, try to play with dogs, especially on their way back home. So there's a lot of sensitization going on in the schools, especially within the districts where these cases have been confirmed. And also, clinical care is very important. And within the hospital settings, during this period, health facilities in these districts have heightened awareness to the extent that anyone that reports with scratches from dogs or any dog bite, a certain system is activated, some preventive vaccines are provided to them. And then, of course, they are educated to ensure that they keep themselves safe. Also, persons who are working in peri-urban and farming areas are being encouraged to ensure that they protect themselves, they wear trousers, and avoid, coming into contact with rabid dogs. But most importantly, we are encouraging the communities to report, the presence of stray dogs or dogs that have unusual behavior of agitation, unprovoked aggression, and agitation. So the service is approaching this using surveillance with our strengthened laboratory systems to diagnose in collaboration with the Veterinary Services Department, and then managing cases or suspected cases that visit the health facilities, and then finally strengthened risk communication and social mobilization.
I also want to hear from Dr. William Chame, who's a senior lecturer at the School of Veterinary Medicine. I mean, technically speaking, are you impressed about the measures being rolled out by the Ghana Health Service, and how do we bring down or possibly eliminate the infections?
Thank you for having me. I hope you can hear me well, but it's raining heavily over here in Marseille as I speak. Yes, I think my two colleagues have said almost all the things But the theme for this year's World Rabies Day, which is One Health, Zero Deaths, is another clarion call on all sectors working to eliminate rabies to come together. Here we have someone from the veterinary sector, another person from the university, and we also have Dr. Latte from the health sector. So we need to go out to the communities together to go and educate at marketplaces, schools, etc. The issue is when you have, let's say, the health sector trying to do one thing, then maybe at times you also have the veterinary sector also doing, it could be similar. The public doesn't see that importance of rabies at times. So we've had quite a number of meetings to work together, and it is even cheaper when we go out there to educate the public. So from our veterinary medical point of view, we still do not know the number of dogs we have in Ghana. So sometimes planning for vaccination is also a big problem. Few times we get the vaccine, then we go to the communities to do such vaccinations for free. I think free vaccination may be the right way to go about this, but we have quite a number of people in Ghana who cannot afford. We go to the northern part of Ghana, we go to other places, even in Accra, you have people who cannot afford 3 square meals a day. So how much more would you maybe ask such a person to pay for vaccination of dog? One vaccine may cost just 10 cedis. I'm saying just 10 cedis because I want to compare it to the human vaccine, which may cost you around 400 or 500 cedis in case you are bitten. We know that this is supposed to be free, but of course, money is not there to provide these vaccines at our hospitals so that people who are bitten receive bites from suspected dogs that we think may be carrying the virus to get this vaccine for free. We also have people living in far to reach areas who may not have access to such hospitals. So I think prevention is better than cure, as we always say. So vaccination is the way to go. And for dog vaccination, we can also go with the medical people, sometimes the environmental health or disease surveillance people who are also stationed or who are working with the Ghana Health Service who join us. As we do our vaccination, they also talk to the people on how to stay safe. We can do the same. But for me, the group work is cheaper, it's better, and it works better. So my focus is on using the One Health approach in rabies elimination.
Our conversation. I'll give you a minute each. Let me start off with Benjamin Kisi, your message to the public.
Okay, so thank you very much. This year, World Rabies theme is One Health, Zero Death. And this is what it has coincided with what the lecturer said. One Health, we come together, environmental people, the report system, how we could join hands, and we call for the media to grant space for it to sensitize the public about rabies. It's something that is around and people have been trying to pick their vaccination. Check whether they have not done it. Here is the lesson.
For you, Dr. Latte?
Yes, thank you very much. As a service, the health of the population is our concern. And one of the things that we want to advise is that people should be very cautious about stray dogs. And then those who are owning dogs should ensure also that they get these dogs vaccinated. But most importantly, if any person in the community gets a dog bite, a scratch for adequate care. Thank you very much.
Dr. Chami, let me wrap up with you.
Yes, thank you. Yeah, interesting enough, Posonchi that has reported human rabies case or cases this, I think, just this month is the district that the vaccination took place not long ago. It then means that vaccination cannot take place just once and we go back to sleep. It must be continuous. We must repeat it every year. If not, rabies will not be eliminated from Ghana. Thank you.
Anyway, gentlemen, I'm grateful for your time here on The Pulse. In fact, I will still keep our eyes on that and bring you some updates as and when we have it.